All right, thank you everyone for joining, and if you're coming to us later, welcome. Today we've got a really great topic. It is the occupational English test. So here's a quick overview of what we'll cover today. I'll do a quick introduction and talk about, and then hand it over to Suzanne, who's going to talk about the OET and why it matters, what to look for in an instructor, and also go over some tips and mistakes to avoid. And we'll do a very simple closing. So who are we? My name is Ian. I am the founder of Lotalingo, a global mobility platform. And we're really lucky today to be joined by Suzanne, an English instructor, a certified OET tutor, and very cool, a previous nurse in the UK. So she's got that experience. Can I prepare with AI? This is just a quick note. I've covered this, I think, on a couple of different topics before, but it's worth reiterating, especially around anything related to exam preparation. So I think the top level takeaway is that AI, remains a great tool, but if you really want to be a competitive applicant, you still need expert help. So, where is AI really good today? If you want to just get a ton of repetitions on vocabulary and grammar, AI can generate infinite prompts for you in a very low pressure practice arena. And that's generally not the best use of time for an expert like Suzanne when you only have 45 or 50 minutes, where you want to be covering more, concepts and things like that. So where is AI going to struggle more? Obviously, it only has access to what's on the internet in its last training run. There are inconsistencies and hallucinations, so you can't rely on these things 100%. And there's not personalization on you as a student, whereas again, a certified expert is going to have built a lot of custom programs for students like you. It has to go through multiple trainings on a yearly basis, and obviously has access to confidential material that's not published anywhere online. So with that quick note, just because it's always a question that comes up, I will go ahead and hand it over to Suzanne. Suzanne, thank you so much for being with us.
Okay, thank you for having me. So why OET matters is what I'm going to cover first. Obviously, there's other exams that many countries accept to show your level of professional English. But especially if you're a doctor, nurse, vet, primarily it's mainly doctors and nurses taking it, but they do cover all 12 healthcare areas. And it's not just, I think a lot of people think it's just accepted in the UK, US, Australia, but there's actually more than 400 organizations now across 20 countries. For example, Malta have just accepted it for nurses as well. So there is a far more options than people think. It's not just the main big English speaking countries. And I think just to reiterate, it does cover the 12 healthcare areas. So for example, if you're a pharmacist, whilst the listening and reading is all the same for the 12 healthcare areas, if you're a pharmacist or an optometrist, for example, you will have your own speaking and writing part, which I think is really, really beneficial. Yeah, so it's just the listening and the reading that is shared with all the 12 healthcare areas. Okay. I think having, like what Ian said, my background is nursing. I was a nurse in the NHS in the UK, in London, where I'm from. Having that background, I can totally see why it is more useful if you're a healthcare professional to take the OET exam rather than IELTS or like the Pearson's test. Whilst yes, they can both establish your level as well. The great thing about OET is that you're learning skills and vocabulary that you're going to use in the job. Yeah, I'm not saying there's nothing that you're going to learn from IELTS or PT, but pretty much everything that you will learn from OET, you're going to use it at some point in your job. And I know this from feedback from students. They're like, wow, that I understand now why the OET speaking criteria is that, because I'm now a better communicator by doing those things in the real world, not just for the exam. Or, the vocabulary you will learn, you will hear patients using that vocabulary or colleagues using some of the more medical technical terminology. So for me, the main bonus is it's not just going to help you pass the exam, but it's going to give you so much more confidence when you start working in the real world. Yeah. And the last bonus of OET is there's 3 different ways of doing the test, depending on where you live. So you've got the paper test. There's still many countries where you can go to a test venue and do it on paper if you feel more comfortable doing it like that. You've got OET at a test center, and there's OET online at home. Again, you just need to check which country you're planning to work on, which type. Some accept all 3 forms, some will only accept some forms. So that's just something you need to double check when you're more certain about where exactly you want to work, and you can double check straight with the Board of Nursing or Medicine, which is more beneficial for you to do. So yeah, they're my main reasons of why OET. And that's, I used to teach IELTS as well, before I started teaching OET. So yeah, it's having taught both, I can totally see, being a teacher and an ex-nurse, why there are so many more benefits of doing the OET exam. So yeah, hopefully that kind of summarizes for you why you should be interested if you're a healthcare professional. Going to move on just to talk about what to look for should you choose to do the exam. A bit like what Ian said, yes, there are things you can do on AI, and I would encourage you to use AI for things like grammar practice. We don't want to spend 30 minutes of a lesson going over present perfect or past perfect when you can do that on your own. You really want to use your lessons for doing speaking role plays, which is going to be very different from doing it with AI as well. It's never going to create the right amount of empathy that is going to be required in the exam. So yeah, AI for some things, but for other parts, you really, really will benefit from having an OET instructor. So the 4 main things to look for: check that the person, the tutor, has their OET knowledge badge. So if you have completed the steps with OET Australia Online, you are awarded a digital badge. So most people will have this and be able to show it as proof. A second thing you can do is, if you actually go to OET.com, they have a list of all the organizations and teachers, individual teachers, who have been awarded the OET knowledge badge. So you can always double check on OET.com as well. A tutor with a healthcare background is not essential, but it's certainly useful. So, not every tutor for OET will have a medicine or nursing or pharmacy background, but there's a small percentage that have them, these degrees or experience in working in that area. And it's certainly useful. And again, I can say that coming in as an ex-nurse, being surrounded by doctors, physios, occupational therapists, radiographers, I think we can play role plays in a more natural way because we've been with patients quite often in those scenarios. And we know exactly what kind of empathy a patient is expecting if it's a patient from the UK, US, Canada, New Zealand. So it's certainly useful to try find someone. If they have it, it's a bonus, okay? Ian touched on it as well. If you use AI, they're probably going to give you a lot of material. Some of it will not be genuine. Some of it will be. But again, when you have that OET knowledge badge, you automatically get access to OET Australia's teaching. They call it the PPP file. That material is not online. You can only get it if you have private classes with an OET provider. So that's something that you're not going to find on social media, or ChatGPT AI is not going to be pulling from those official sources apart from the free ones that are on OET.com. But there's only 5 free ones. If you have the OET knowledge badge, we have access to numerous more official tests and updated tests. And just to touch back on what Ian said before as well, when you are an official teacher, you get invited to OET official teacher training sessions. There's one coming up at the end of the month. And again, AI isn't part of that. So anything that gets updated, they're often sharing things they like, they don't like. We do training sessions in reading, listening, Also things like speaking and writing, to make sure that we're giving grades that are somewhat similar to what OET examiners are giving. So they're the main reasons that you should get an OET qualified tutor. Okay. Just to share with you, I've been teaching OET for about 5 years now. I was teaching general English and medical English before that. So these are my own personal tips for the exam. The first one and most important is be realistic with your time frame that you need to pass the exam. I think some students are a little bit unrealistic and maybe think, okay, in 2 weeks I can pass. And I'm like, okay, what have you been doing already? Nothing. I'm like, and everyone's different. Everyone's unique. Some students come into OET preparation already with that grade B, C1 level, and they can prepare in less time. But for example, if your level is B2, you can't go from B2 to a C1 in a matter of weeks. I know this because I'm learning Spanish and I do my exams myself. Yeah, B2 to C1 is the biggest jump. Okay, so just be realistic with that time frame. And I would recommend that you already minimum B2 level before doing OET preparation classes. So if you're a bit rusty on your grammar, work on that a bit before you start with a tutor. And that's when you can go online, and there's numerous free resources for doing that. My other third tip is do not dive in at the deep end. OET explain this in a really nice way, that a lot of students make the mistake of just looking for as many free sample papers as possible, doing the tests in test-ready conditions, and then just repeating that as much as they can. They compared that to that the OET exam is like running a marathon, and that's the equivalent of running a marathon and you haven't done any training for it. So, my brother, when he did it, you got to start off with a 2K run, a 3K run, and build up. So the worst thing you can do is try just to do papers in test-ready conditions in week 1. Yeah. So just start off with becoming familiar with the exam, learning tips and strategies. The first time you even do a paper, don't time yourself. Just, really practice the strategies, and you will gradually get quicker anyway. Okay, so don't rush to try find as many sample papers as you can. There's a reason why OET doesn't have as many papers as IELTS, because there's plenty more things you can do. It's not just based on how many sample papers you do. Okay. My fourth tip, immerse yourself in English. Only watch TV and movies in English. Watch pods, interviews, healthcare TV shows in English. There are many, many, many pods, TV shows. OET even recommend they have the top 5 TV shows to help improve your listening, vocabulary. You'll get nice ideas for speaking as well. So if you're not already doing that, start. It's great if they're healthcare based, but even at the start or something on the side, pick a show you've already watched maybe, and have subtitles off. You're not going to have subtitles in the exam. So that's a good little side thing you can do to build yourself into it. As I mentioned before, the listening and reading covers all 12 healthcare areas. So for example, if you're a cardiologist, stop reading around cardiology. I'm sure you've read numerous articles about the heart or hypertension in English. Start reading around some hot topics in other areas, because you're going to be tested on not your knowledge. It's not a medical knowledge exam, but your opinions of other big, broad topics within healthcare, like rising obesity, aging populations, more people having diabetes. So they're generally more broader topics, and they're testing your opinion, your ability to listen and read for opinion. So even reading things like The Guardian, famous UK newspaper, they have an opinion section. Avoid the politics part, but a lot of them are healthcare issues, social healthcare issues. So these are other things that, and this is what OET have told me in training sessions, they think as healthcare professionals, in order to stay at the top of your field, that you're already reading and listening in English, because most research is published in English. So they think that that's not new. You're just going to be doing more of it once you decide to do OET. I know for most students, they're only in a position where they can speak English, maybe when they're doing a class. So, if that's only once or twice a week, it's hard to improve fluency and confidence. So find a speaking partner. You can find a particular OET speaking partner if you want, and meet up a couple of times a week and practice role play cards. Join meetups with internationals, or there's many websites where you can do free language swap, and you can just say to the native person, like, can we just talk about healthcare topics, or tell me about a time you went to the GP? So they're using native lay terminology with you. Yeah, they can even make up scenarios. Okay. The other thing, just be aware of the material that you're going to find online. Every year that I'm teaching OET, I see more and more material being published. Some of it's really good, some of it's official, some of it is not official. And you will know because you can go on the website and see if they're listed on oet.com. And my last point is just to reiterate, it's quality, not quantity. The student who does 50 papers, probably 80% of those won't be legitimate anyway. Doesn't necessarily mean they're going to pass, compared to the student who maybe does 12 papers, but really spends time analyzing where they went wrong, listening to the audio again, looking at the transcript, going up and looking up words that they weren't sure of, adding them to a list, reviewing those new words on a regular basis. That student has got far more chance than the student who's just flying through papers and not reviewing where they're going wrong or getting specific feedback, because chances are you're just going to keep making the same mistake again and again. And yeah, I have got students saying they're practicing speaking with AI between classes. It's better than nothing, but it's not going to be the same. As much as I think AI is great for some things, it's not the same as talking to a person. Yeah, you're going to get a variety of, just having been a nurse, I think you can only really show genuine empathy when you're speaking, to another human. It should come more naturally. And just remember, AI checking letters, yeah, they'll give some good feedback, but it's not going to be up to date with necessarily what has changed in the last few months with the last OET teachers training practice. So for speaking and writing, 100%, you need feedback from a qualified tutor. So hopefully that summarizes all of my tips for helping you to pass OET or start preparing for the exam. Some of you may not know much about OET, others do. So I just want to reiterate the 4 sections. So for speaking, if you haven't seen on oet.com, there is an official criteria. It's quite long. It's 2 pages. You have 1 page for linguistic skills and 1 page for clinical communication skills. Again, a lot of the linguistic stuff, you can use AI because that's checking you have the right grammar to ask questions or things like that. But particularly the clinical communication skills, empathy is huge in the OET exam. And a lot of students I know find that quite hard. Sometimes it's culturally different because they're like, actually, where I live, patients don't expect the same amount of empathy as maybe a patient from the US. Like, I live in Spain. Having lived in Spain for a while, people get to the point more. They're a bit more direct. At first, I thought it was rude, but now I know it's not rude. It's just the culture. So I don't expect the same level of empathy from my Spanish doctor as maybe my English GP when I go home, but it's just cultural differences. So sometimes things that you say you might not realize are a little bit more direct for a native person. And it's just getting that feedback and advice from a native tutor will really help you, because a lot of people are so focused on the linguistic skills, they're not bringing enough empathy and they're losing points with the clinical communication skills. And like, some doctors seem to think, well, the more I talk, the more points I'll get. But it's not. It's a 2-way conversation. If the interlocutor is not talking, something is going wrong. You're not checking back in enough if your patient is understanding you, how they feel, do they have questions? So you have to be able to know when to offer the floor back to the patient, played by the interlocutor. Okay, so really, really focus on those clinical communication skills. And that's the main feedback that you can get from an OET tutor. Okay. The second, listening. As I mentioned before, stop using subtitles. Okay. I'm doing the same in Spanish. I'm rewatching Friends because I've seen it many times in English. So I know the storyline. So I'm just trying to really focus on seeing how much I can understand and just build it up, then maybe build up to a show that you've not seen. And obviously, if it's got a healthcare theme to it, even better. With listening part A, most of the answers come from the patient. Maybe one question, if that, will come from the the healthcare professional. And what a lot of particularly doctors and nurses have difficulties with is they lack vocabulary, like everyday lay terminology that patients use. Patients aren't always going to use the medical terminology. Like a patient is not going to talk about their clavicle. They're going to talk about their collarbone. A lot of my doctors are like, I've never heard collarbone. They know the medical terms, but in listening part A, the answers come from the patient. So build up every time you have a medical word, go online. What's the lay term to go with it and learn both? Because in writing, you're going to want to use medical terms if you're writing to a healthcare professional. But in speaking, you should actually avoid those terms and know the lay terms. For example, I was doing one about a fractured tibia. My dad doesn't know where his tibia is, you know. He might know it's somewhere in his leg, but he won't know specifically. But if you say your shin, he's going to know that. Yeah. So start working on lay terminology, and spelling is a big thing. Listening part A, you pretty much have to spell any common general medical words correctly. So that's something you can do without a tutor. Spelling tests. There's many apps where you can improve spelling. And the big thing is once you've kind of got familiar with the strategies, you have to learn to multitask, to listen and read answer options at the same time. Third is reading. For part A, and I'm sure some of you have you're doing this every day at work anyway, but skimming and scanning, you've got to be able to do that quite quickly, especially in the first part of the reading test. Again, there's many exercises you can do online to help you with skimming and scanning, just even general text before you move to the OET text. Again, in terms of vocabulary, reading part C and B, really, you're really going to need more formal vocabulary. These are like articles that you will find in journals. Yeah. So you're not going to see a lot of, everyday language. It's quite formal. So I'm sure a lot of you as healthcare professionals, I know when I was a nurse, I had a subscription, to a very popular UK nursing journal. And it is written in a rather formal way. So if you're not reading journals on a regular basis, or, staying away from like daily tabloids, but more things like the Times, the Guardian, you're going to learn more formal vocabulary and practice these things again before you do them in timed conditions. The last part I want to talk about is writing. A lot of times, especially when I'm working with doctors particularly, they're like, that's not how I would do my letter in the real world. Who cares? Give OET what they want. Yeah. You might like some things that you learn from OET and bring it into the real world. Maybe in the real world, there's a template that you use on the computer. Like I know a lot of doctors had for discharge papers in the NHS. But for example, my GP, when he referred me and I saw a copy, it was very similar to the type of referrals expected in the OET exam. So the more you know the criteria, the better you will do. And you just learn to start knowing from the criteria and official material the style that OET want you to write in. Yeah. Yes, it's a polite letter, but it's not like, maybe if you've done some IELTS training, you'll find it very different. You're not writing an argumentative essay. You're just trying to write in a clinical, concise, factual style, because in the real world, doctors only want to read what's really important and leave out what's irrelevant. They don't have time to reading 3-page letters. If you're not familiar with ISPAR is used not just in English-speaking countries. For example, I think in the US, the military use it. It's a very good tool for communicating clearly, introduction, situation, background, assessment recommendations. I've got a lot of doctors saying, yeah, we use that in my country. It's not just in native speaking countries. And it's a very good tool to use for thinking out of planning your letter and what content you think the reader will need. Where AI can help is definitely working on your grammar, spelling, where to put punctuation, and that will reduce, it won't take time away from one-to-one lessons going over that with a tutor, when really you want to be getting grades for your letters, doing role plays, guided strategies for listening and reading. So those things, work on them. Ideally, start working on them now. Even if you're not planning to do OET for another year, you can start on that now. Yeah. And my last biggest thing is, you've got to put yourself in the shoes of the reader. You could be writing to a doctor. Generally, that's easier. What would that particular doctor want? But what if you're writing to a nurse, an occupational therapist, a speech pathologist? You should be confident with what allied professionals do, so that you can pick the content, not for you, the person writing, but the person receiving your letter. What do they want to know? So if you're not familiar with what's the difference between an occupational therapist and a physio, read about that before you go into OET preparation, and I know in some countries occupational therapy doesn't exist, or it's a very small department. Having worked in the UK, occupational therapy is massive. They are part of multidisciplinary team meetings. They are discussing the patient with nurses, doctors, and physios. So they will expect you, okay, if you don't have it in your country, fine, but you want to work in a country where it is really popular and you will be communicating with them. So you should know what their job is. Again, read about it online. You can get that all online. So basically the order of the test will be listening, reading, and writing, and then the speaking is done separately. So those are the 4 parts that cover and make up the OET test. Yeah, hopefully you've got a bit of a better understanding about what you need to do if you're thinking of taking the OET test.
That was fantastic. Thank you so much, Suzanne. That was really helpful. I learned a ton. And I'm actually realizing that Li Kong had given us 4 questions, I think, from the audience that he collected from social media. So let me just pull those back up. And then I'll represent here.
Okay.
Okay, so I think some of these you might have already answered, but okay, here's one. So in the speaking section, does the examiner pay more attention to the candidate's expression of professional vocabulary, or is it fluency with the language, or is it both? I'm guessing both.
Yeah, it's both. You'll see on the linguistic criteria, there's 4 parts. So it's pronunciation, basically, and that you can intonate correctly, fluency, and then use of appropriate language, which actually, again, if you're talking to a patient with no knowledge of the subject, like they've just been diagnosed with diabetes, you should be avoiding medical jargon and not using abbreviations. And doctors are guilty of using it too much. So OET often put medical jargon on your card to see if you avoid it or can explain it simply, and that gets you more points. Yeah, because you're not talking. If you were talking, if it was a conversation with a colleague, another doctor, great. The more medical, the better. But OET are presume your patient has limited knowledge of this subject. Explain things nice and simply. And doctors struggle more than nurses with that. So that's one thing. Having been a nurse, surgeons or doctors will come along, explain things. You got any questions? The patient is kind of too embarrassed to ask, and they'll go, "Nurse, I didn't actually understand some of that. Can you go over?" And I'm like, "Why didn't you ask him?" "Oh, no. I know they're busy, or I don't want to come across like I'm silly." And I'm like, listening on the bedside, I'm like, oh, why are you presuming they know what an endoscopy is if they've never had an endoscopy? Or their nurse will give you IV fluids and a cannula. If you've never been in hospital, what does IV stand for? And what is a cannula? So then the nurse will come along and explain very simply what a cannula is, an IV. I'm not even going to just say intravenous. I'm going to say it's going to go directly into your vein. Intravenous is medical terminology.
I'm hearing some personal story come through there, some personal experience.
Yeah. And doctors more so go, oh my God, this is great, because I'm realizing now, actually, even in my own language, I'm too technical. I don't check if I'm using enough simple terminology. I was like, you can use the medical term, but follow it by that. That is like, you are hypertensive. By that, that's the medical term for high blood pressure. Yeah. So you can do it in a way that's not condescending, What's condescending is like, do you know what blood pressure is? No, check what they know about the medical word and then explain it simply. So one is not more important than the other. The more you know the criteria, the better you will do in the speaking, because linguistic is worth 24 points and there's 4 sections. So you get 6 points for each. And doctors lose most points in the 3rd column, you'll see on the criteria, for being too technical. They're not talking with the right genre for a patient who is new to this diagnosis.
That's a fantastic tip. All right, so for the second question, it's in the writing section. What are some common mistakes people make? And do you have any sort of go-to techniques that tend to earn candidates higher scores?
So common mistakes that I see and that I know from OET teacher training is students missing the purpose of the letter, because I think especially some students, they can't help but think it is a medical knowledge exam when it's not. So they sometimes elaborate on the case notes and add in their own interpretation of the case notes, which is not required. I'm not a doctor and I can do any of the OET medicine papers. I'm not a vet and I could do it. I work with vets, pharmacists. That's not my background. So I think doctors go in thinking, or nurses, pharmacists, that they're looking for an interpretation of these things. It's not. The examiner is not a doctor. They're not a nurse. They're an English OET language examiner. So they start kind of going off on a tangent about things that are not even in the case notes. They're like, yeah, but I think the reader should investigate that. I'm like, but it didn't ask you in the case notes to do that. Even if you think that, or for example, they get presented a provisional diagnosis. Now, but look at those results. That's definitely a diagnosis. I'm like, it doesn't matter. The examiner is seeing that they presented you with a provisional diagnosis. You've got to talk about it like a provisional diagnosis within your letter. So I think sometimes applying too much medical knowledge or your background knowledge, you've got to remember it's a language exam is the most part. Yes, you get 7 points for selecting content, but like, I'm not a vet. 80% of it to me is really obvious what another vet would want, like a vet in a hospital from, a regular clinic vet. So there might be 1 or 2 things that you might have to think about. Is that useful? But generally, most of it is actually obvious. And I can say that because I've done pharmacy letters and I'm not a pharmacist, but I'm like, yeah, I think another pharmacist would want to know that. Yeah. So don't add in things that are not there. Do not change the diagnosis, even if you think that doesn't make sense to you, because the examiner is looking at the case notes. So that's one common mistake. And also, having attended OET teacher training sessions, if you score wrong in purpose or content, they're interlinked. And OET have fed back doctors more so than nurses lose more points in purpose and content by changing the task to what they think. Interesting. And having marked papers, nurses will just literally, that's what you've said, that's what I'm putting into a sentence. But doctors overthink it sometimes, and it's not required. And then they end up losing points in purpose and content. And then you're relying on having perfect language, perfect layout to try compensate for that score. Yeah. That's something that I think you wouldn't know unless you attend those OET teacher training sessions. There's common things with language. I think some people initially come in with the wrong genre and style. Maybe they've done IELTS training previously, and I've got to like erase what they've learned in IELTS and teach them what OET want. A lot of students write in a more like, way if they're writing a dissertation or an essay, but it's not. It's a clinical, factual letter. So sometimes, like, you'll see things in view of the above, and I'm like, grammatically, it's correct. Not getting you any points. IELTS will love it. OET are like, why would you bother writing that in a clinical factual letter? It's just a waste of word count. So there's some common things I see, but again, common in that you will only know if you have your knowledge badge and attend those things. Maybe another tutor will talk about things like tense choice, but I don't want to highlight that because that's obvious. That's an obvious thing you will know for yourself, that grammar needs to be correct. So you summarize the case notes correctly, but you can work on grammar on your own.
Yeah, another great tip. Okay, the third question is, I think you covered podcasts and some things to watch for speaking and listening. Are there websites or books that you recommend to improve listening and reading section skills?
Yeah, so you'll see on OET.com, I mean, they just list 5. There's far more than 5. I think out of the 5 on the OET.com website in terms for listening would be GPs Behind Closed Doors, a UK show where real-life NHS doctors have permission from their patients to record their consultations. Far more useful than like Grey's Anatomy, where half the show is about their love life. That's not going to be in OET. And another one that I really like is Embarrassing Bodies. Again, you can watch these on YouTube for free. Another one that's quite recent that it's not on OET's list, but that I really recommend is called Dr. Christian Will See You Now. Again, real life UK GP. His patients have given permission for his consultations, appointments to be recorded. And for him particularly, I think he's one of the most empathetic doctors I've ever heard. So you can get a really good idea. If you're uncomfortable with the level of empathy you need to give, this guy is just a natural at it. It's like he doesn't need, it's just oozing from him naturally. So yes, you'll improve listening, but you'll get some really nice ideas for speaking as well, how to communicate with the level. We call it good bedside manner. Even we use that even if you're not next to the bed, but you should have good clinical communication skills with your patient. And I think even though he's not doing OET videos, he's just naturally demonstrating a lot of the skills from the OET criteria. And yeah, I mean, pods, it's never ending now. Like if you even just go on Spotify, like mental health pods have become really popular. Again, mental health is something you might have in listening part A, somebody going to their GP because they're depressed or anxious. It could come up in reading part C. We all know since COVID, people are having more issues with anxiety, depression, just with what's going on in the world. So they're real topics that could come up. With reading, again, my main advice is go to journals that you're not used to reading and from other areas, so that you're like, what's hot and new in the world of physiotherapy, not to improve physio knowledge, but just learn about some of the opinions being shared within that, So I mentioned it before, the Guardian newspaper, I love the opinion section. You can read it online for free. Just go to google.com, put in the Guardian plus opinion. You can even go plus mental health, plus obesity, and it will bring up all of the articles there. And it's written in quite a formal way. I think even a lot of natives might be like, oh, that's a new word for me, because it's not like reading something like the Daily Mail where you're not going to learn any new vocabulary probably, or certainly not that will be useful for OET. So on OET.com, under the reading part C guide, they have some links to journals. But for example, if you're a doctor, maybe stay away from the medical ones. Why not have a read of a nursing one or an occupational therapy one? Like, get out of your safe lane and start reading. Again, not to expand knowledge, but just learning about opinions being shared in other areas of healthcare settings. And there's many for free. You don't have to pay a subscription. Some are you have to pay, but there are many for free as well online.
Yeah, I love the Guardian opinion section.
Yeah, it's great.
Really great. Okay, last question is for those. Oh, this is funny. For those taking the exam for the second time, what should their focus be on during review?
Yeah, and it's not common. I often have students start with me and they'll say, this is my second time, this is my third time. One common mistake that I see is students automatically book their next exam date without stopping to think or reflect on their scores. Like, if you got a 290 and you need 350, why are you booking the exam 2 weeks later? You're just throwing $450 away. So be realistic with your scores to try think of a timeline when you should sit again. Instead of wasting money on another failed exam, put that money into a tutor. Put time into what you can do for free or on your own without a tutor. I think it's realistically, sometimes some of it will be self-reflection and you will know what you need to improve, but some of it you won't know unless you've had feedback from a tutor. Maybe you are not seeing, maybe your grammar is quite good, but half of it is irrelevant content, or you think your genre and style is great, but it's not in the style that OET want. So I would say be realistic. Don't jump in and book straight away without getting some feedback from an examiner and some self-reflection, like really looking at the writing criteria. If you thought you were going to get a grade B, but you got a grade C, look at the criteria again and really ask yourself which sections of it actually maybe, I'm clearly not a grade B. So where am I going wrong? But I think the main thing is time and getting some one-to-one feedback, because every student is different. What is wrong for one student, another student is getting right, but they're getting something else wrong. So I think you just need to get that one-to-one feedback to really figure out a personal, individual study plan and sessions for yourself.
Fantastic. All right, well, thank you all so much. If you're coming to this later and you want to book with Suzanne directly, you can go over to latalingo.com/Suzanne, and you can find her there for a trial session or a one-on-one. So thank you again, Suzanne, for joining us. That was really helpful.
You're welcome. Thank you.